One of the things we both touched on is data and access to data. Being a semi-professional cynic, I think that data without a plan behind it is not as important. And when you can't go to a healthcare conference today without hearing data is important, here's what we're going to do about data and big data and all the things that are really important and valuable and things that we do and invest money on. But if we have data that's not actionable, if we have access to information that's not being used by the organization, that to me becomes a little bit of a challenge. So the question is the solution more access to data, or is it getting access to the data in the right hands of the people that can do something with it? And talk to me about your perspectives within your organizations on that.
Yeah, so I'll tell you, David, it depends, right? It's the famous answer that everybody, right?
There's a future in consulting for you, my friend.
That's right, thank you. Yep, so when we think about data, right, is it more data, is it more actionable data, right? I'll call it that way. And I think for us, it's about understanding the data itself, because there is not a shortage of data within our space. It's how do you understand the data that you do have and couple that with what is it that you're driving towards, right? So if we understand what we're driving towards, then we have a better shot at saying, okay, now that we know where we're headed and what outcomes we want, then we can understand a bit more about the data that we have. You need relevant data, you need reliable data, you need clean data, right? So I think understanding those two pieces is good. And how do we do that? So we start with educating the organization around, here's the data that we do have available to us. Now, what do you want to do with that? And then once we understand that, we then set very clear objectives about what actions that we want to come out. So that way we understand, okay, so here are the insights that we're going to deliver around the data that we have. So there is something to, give me more data, but I'm interested in giving you more actionable data than just giving you more data, especially if you don't understand what you're going to do with it. Because then we're just building for the sake of building. So.
No, I totally agree with what was said here, of course. But I think there is, in places, there has been a need for data. They have not had the right insights, but that's kind of being solved, I think. The data is becoming a lot more democratized, or the access to it. Better tooling, things are now available. But to Onyeka's point is, how do people use it? And I think he talked about training and education. I think what we can also do is start with, okay, what is it that you're trying to solve in your operation? Back to the business and the experience. And then we can walk back to the data and how we present it and how we slice it and dice it. And frankly, since we're the rebels here, sometimes it's okay, I'm going to stay with this to help them use that data. And presumably somewhere else or in the next step, beyond that data, they will probably need maybe some automation, and maybe some other technology, maybe some more data. So we're there on that journey with them.
I think that's great. The notion that we have to view the balance of the health organization as a customer. And a customer for life, right? Like, we can't just drop in technology and walk away. We have to continue to support that and help them act on that. Because I think one of the things that I spent time in industry that always frustrated me is, I called it a lack of corporate resolve to act on something, right? Even if you know something, do you have the resolve within the organization to make a meaningful decision, and a tough decision? Investiture, divestiture, personnel-related things, calling people out for behaviors that are not consistent with the culture of the organization. Those types of things, I think, are hard to do, and if you have the data to do it and still don't do it, that becomes increasingly frustrating to people that understand that.
But I think it's more than, yes, absolutely they are our customers, and therefore we are their providers, but I think we're also partners. I think that's very important, because together we can evolve these things. It's not me delivering a report and them going and doing something with it. We stay on this in a relationship. It's a relationship between partners.
Yeah, and you can have those conversations, David, when you do have kind of that fact-based, right? So if you've got the data, you've got all the actionable insights that you can get from that, then you can have a fact-based conversation as opposed to anecdotal about what could or couldn't be.